Now we scanning the right lower abdomen or right iliac region. Here we see the distal ileum, which appears to be normal and walls are not visualized. Here we see a hypoechoic area with well-defined margin, and it is lies anterior to the distal ileum. It is an abnormal finding. Now we continue scanning this area. These are muscles at right lateral side. Now rotating the probe at its axis, it becomes a lumen which contain fluid and debris. This is appendix which is inflamed, and this is cecum. The appendix is lies anterior left lateral side of the cecum and anterior to the distal ileum. The peripendicular tissues are echogenic and inflamed, but no free fluid seen. Now we will measure the anterior-posterior diameter of appendix. The anterior-posterior diameter of appendix is 12.4 millimeter, and the normal diameter of appendix is up to 6 millimeter. Here the wall of distal ileum are also mildly prominent and inflamed. Now how we will write report.